Hi, my name is Dorothy Drew. I'm a hypnotist. I provide hypnotherapy services for people. I specialize in people with physical issues, people with chronic pain, and this video is just about how the work I do, how my training, how my skills can help people in their recovery from a stroke. So I'm just going to share my screen and okay. So people who have had a stroke, if there are multiple causes, there's multiple effects, but overall, I can help people to reduce the pain that they have, to reduce some of the symptoms they have, and this is just the explanation of how. I do it with hypnosis, which is just a very relaxed form. It's it allows you to connect with your subconscious mind, to understand what's going on in your unconscious mind. I help to do energy clearing. I'll give a description of what would be involved and a little bit about my background at the end. This presentation is not a substitute for professional medical advice, diagnosis, or treatment. There are no guarantees, but there are many successful stories of clients who have had relief of symptoms or who have progressed further with other modalities because of hypnotherapy, both by myself and by my colleagues. I got into learning about hypnosis when I had a rapid transformational therapy session, which is the therapy taught by Marissa Peer. For my son. My son was born with brain damage. He has a cyst in his brain about the size of a large orange, where brain neurons were destroyed. The area around it is damaged. I mean, despite that, he's an amazing man, and he's had a degree in history, and he's very intelligent, but he does have some issues because of that stroke. So cerebral palsy is simply a label. It just is the definition of someone having a stroke before the age of 18, most commonly happening at birth. The stroke can be neurological. It can be, from an accident, a concussion on the brain or something, a blow to the head. So I had the session for him at the age of 32. He was 32. And at that time, his hand was in a claw shape. And this claw shape is very typical of people who have had a stroke. It just means part of the brain controlling their hand was damaged. The muscles don't get nerve signals and they shrink. The medical term is atrophy. And that shrinkage then makes it harder and harder to use one's hand. After the RTT session, after hypnosis, his hand opened up, his hand relaxed. And for him to have gotten to that state before RTT or without hypnosis, you'd have to have a long, painful session with physiotherapy. So when I saw this, I mean, I was in awe, and I decided then I wanted to learn how to use this technique and how to help other people. So a client that I worked with who'd had a stroke, it had affected his face. So one half of his face was very affected. It was kind of droopy. It affected how he could speak. And he was embarrassed. He was frightened to leave his house. He didn't want to see people. He was afraid of being laughed at. He just felt so awful. So after the RTT session, the damage to his face, it was there, but it was less visible. His speech was a bit clearer. But the main factor of what helped is he stopped worrying about how he looked. He stopped worrying about how others react. And that's one of the things Marissa teaches. You can't control what happens out there, so you can only control what happens inside you. So by believing in himself, he was able to leave his house. I mean, this was before COVID. He was able to go out and spend time with people, and it was significant, the change. Another success story I had was this client wasn't a stroke, but because he had so many issues somewhat related to people who have mobility issues. He was in his 70s. He had slipped on the ice. He cracked his pelvis. He'd had several surgeries, and he had extensive scar tissue, which was then affecting how his hip joint worked. And he had a lot of pain when he was walking. And because he was out of balance, they were considering whether he might need a hip replacement. So when he had this session, there was a lot of emotional grief from when he was a teenager when his grandmother died. So that emotional grief had nothing to do with his fall, nothing to do with his pain when he was walking, but it had an effect on his immune system. So he felt a huge weight being released by letting go and understanding how much that grief had weighed him down. And then we did a lot of guided imagery, and I did the recording for him that's based on his issues. So a lot of the scar tissue shrinking, the scar tissue softening, the hips moving into balance, muscles that needed to contract were getting contracted, muscles that needed to release were releasing, so that his hips were balanced, his shoulders were balanced, his spine was in level, and so he could walk without pain. What was significant was just a few days after that session, he saw the physiotherapist, he saw the chiropractor, and they both said, something's changed, your bones are moving. And even a good 6-7 months after the session, he was still listening to his recording because with the recording, he could walk without pain. He was no longer being considered for hip replacement. And he said he'd rather listen to a 20-minute recording than take medicine with side effects. So it was a fantastic result from hypnosis, from hypnotherapy, from guided imagery. So one of the main effects of having hypnosis is that being able to move forward. So the people I've worked with who have had a stroke, they've come to me when they've gotten as far as they can with the other modalities. The physiotherapists can't go any further with them. The chiropractic treatments aren't working. Whatever else they've been trying isn't working. So then they come and try hypnosis. And most times it helps reduce pain, helps improve their sleep, helps them to move forward, and helps them to better, be able to have the physiotherapy take them to another step. And releasing emotional or spiritual blocks is an important part of the work that I do. The guided imagery is the basis. And in hypnosis, which, as I said, is simply deep relaxation, imagery is stronger and it's more powerful. So there are a lot of physical effects from a stroke. It depends on exactly what part of the brain was affected, but overall sleep is often affected. So people may they sleep for many, many hours, but they're not getting deep restorative sleep, or they're sleeping too little. They can't get to sleep because of looping thoughts, or they wake up, they can't stay asleep. And most of all, it means when they wake up, when it's time to get up in the morning, they're not refreshed, they're not energized. And it's only during prolonged deep sleep that cells can heal. And that is research described by Dr. Stasha Gomanak, and I'll put the link in the comments below. And improving sleep is one of the most important benefits of hypnotherapy for wellness. So hypnosis is a very fast way of reaching deep sleep, of being able to sleep, of, if you wake up in the night, you listen to it again and you go back to sleep easily. And it's only during this deep sleep that cells get repaired. So letting go of stress, letting go of anxiety, letting go of panic, letting go of fear, this immediate stress helps a person to sleep better and move towards wellness. And that's what hypnotherapy is all about. So not everyone who has a stroke ends up with pain, but if you do have pain, there are tools that we use that can help reduce the pain, help alleviate the pain, reduce the intensity, reduce the frequency of pain attacks. The other main effect of strokes is usually on walking, on mobilities, but it can be on the joints. So if your shoulder is affected, that will affect your whole arm. It'll affect your hand, but really that effect was on your shoulder. So, after the stroke, is there a limp? Is there a strange way of walking? And one of the odd things about a stroke is it can cause one side of the body or one part of the body to disappear from the mind. And with my son, when he was a child and the physiotherapist used to work on him, they taught him how he had to look at his hand to be able to use it. So if he looked at his affected hand, he could hold things, he could manipulate it. But as soon as he stopped looking at his hand, it was like it disappeared. If the physiotherapist touched his arm, he wouldn't feel it. But if he was looking at her and seeing her touch his arm, he could feel it. It's kind of an odd way that the mind works after a stroke. So hypnotherapy helps relax muscles and joints. And that again allows the physiotherapists, the chiropractors to go further. Sometimes if falling could be an issue, learning how to fall safely is essential. And physiotherapists teach this, but there are times where people resist learning such a technique, and then in hypnosis they can let go of that fear. Fear of falling is a big concern. So if you can anticipate, if you can teach your brain, when you start to fall, this is what to do. It's just like athletic performance enhancement. It just gets your body ready so that if you're not afraid, if you start to fall for whatever reason, you know what to do, you can react. And just like that guy who'd had the broken pelvis, visualizing the body being in balance, visualizing it working perfectly, that's an important part of what I do. So arms and hands, sometimes the arms affected, but not the legs, sometimes both. And like my son, the hand might be in the claw position. And so relaxing it, opening up means that once the hand is open, it can then be used. It could, the physiotherapist can help exercise that arm to strengthen the arm, get it back to moving. So in visualization involves a lot of modeling. So if there's an affected arm, you want to compare it to the working arm, or you want it to compare it to the way the arm was before the stroke. The cells have that pattern. The cells can be returned to that pattern. Communication doesn't always affect everybody, and if it does affect you, it will be in different ways. So it may, like that one client, affect your face. It may then affect the way your mouth, the way your tongue moves. It may affect your throat. And if it affects those kinds of muscles, then that's where the modeling, the visualization can make a difference. There are other kinds of communications issues where a person who's had a stroke, they may understand everything said to them, but they're unable to say the words back. So one way to help with that is to simply let go of fear, because it's like a person who stutters. Just the fear that they might stutter makes them more likely to stutter. So if you can let go of that fear and just be calm and relaxed, it helps to be able to communicate. And then it helps to be able to let other people know, hey, listen to me, just be slow. Take your time. Seizures, again, it doesn't affect everybody. It did affect my son. Hypnosis isn't considered suitable for all kinds of seizures, but if it can be used, for my son, it made a huge difference because the mobility issues were frustrating for him, but the seizures destroyed his life. So after RTT, his seizures decreased in frequency, and they decreased in severity. So his seizures went from being about every 5 weeks to about every 9 weeks. So he went from being about 6 minutes long to being about 2 minutes long. And it does take him about a day to recover from every minute of seizure. So just having a 2-minute seizure instead of 6-minute seizure is huge. So that short circuit part, that damaged part. So the visualization is to try and help the cells to resume their normal reaction, to let them be calm and relaxed and not short circuit. Negative emotions has a huge effect on chronic illness, on any kind of disease. So clearing the negative emotions, understanding what was the cause, what was the root reason. It's things like people who are afraid of public speaking often find that it was an event when they were in grade school where people laughed at them, makes them afraid to talk. Well, with the stroke, there's a couple of things. There's the negative emotions that were part of their life before the stroke, things that may have happened in childhood, things that may have happened, decades earlier. Then there's the negative emotions that are because of the stroke. So the biggest one, of course, is fear of reoccurrence. Fear is going to be worse. Panic about what do I do? Frustration, anger, hurt that one's own body betrayed them. Anger at the universe, anger at the divine. Why did this happen to me? So those kinds of emotions, they have to be acknowledged, they have to be accepted as normal, and then they can be released. And releasing those negative emotions, it helps reduce some of the negative stress hormones, helps the adrenalines to relax, helps reduce cortisol, which can act like an acid on the body. It helps the body's immune system. So it just helps the person move towards wellness. And that's what hypnotherapy is all about. So the emotional root cause of a stroke, I mean, there's physical causes, it could be from the blood vessels becoming clogged. But then it's what was going on? What was happening? So what was the emotional component behind the clogged arteries, behind whatever happened? And the more you have an awareness of your past, then the more you can release it. And the suppressed emotions, all those negative emotions, they're more easily released when you have an awareness. You accept them as normal. You acknowledge, you accept, you release. The mind-body connection for wellness is increasingly being proven by research. There are lots and lots of studies now that prove this connection. And I'll not mention it in this video, but it's only in Western medicine that there's a belief that the mind and body are separate. That never happened in Oriental medicine, in Asian medicine. And it's because the Roman Catholic Church used to execute heretics. And a heretic was anyone who interfered with the body. And René Descartes, who was a famous philosopher, he developed the treatise on I think, therefore I am. And that separated mind and body. It allowed medicine to progress without doctors being executed, but it came at a cost. So guided imagery, visualization, it's used by almost all professional athletes. It's called performance enhancement. So whatever it is you call it, it means that you're having an idea in your mind of what your body should do, where your body should go, what your life should be like. And I'll have the link below for Dr. Hamilton. He has this wonderful story of a young man in his 20s who developed a liver disease. He had to have tubes connected to his liver to drain his liver, and he was going to be a semi-invalid for the rest of his life. And he spent several hours a day, because he was bedridden anyway, just imagining that he went into every cell of his liver. He hugged it, he polished it, he let it know, every cell know it mattered. And a few months later, one of the tubes disconnected. And when they rushed him to, and it could be life-threatening, so they rushed him to hospital. And when they scanned his liver was normal. So the theory is this visualization work that he did changed the genes that promoted the growth of new perfect cells. And we know that every cell in your body is replaced. Every 30 days, all the skin cells are completely new. I think it's every 3 months, every cell in your heart is replaced. Every cell in your body is thought that neurons don't get replaced, but they do know that neural pathways can change with practice. And there's lots of studies on that. They know that every atom in your body is replaced about once a year. That was from research done in the 1950s. So the theory is, if you can envision the atoms being replaced by perfectly functional, strong, powerful atoms, if you can envision the cells, the tissues being replaced, why replace them in a damaged way? So with hypnosis, it's a very stronger, powerful visualization, so that whatever was damaged returns to balance, returns the way it should be. There's an amazing breast cancer study that was published in a peer-reviewed journal in 2009. Every woman in this study had the treatment appropriate for the kind of tumor she had, radiation or chemo or surgery. Half of them were given a visualization exercise, like catching all cancer cells, letting them be disintegrated, that kind of thing. All the ones who had this visualization, which is basically really low cost, which is a matter of teaching them how to do the visualization, non-invasive, no negative side effects. All the ones in the visualization study had better results of their treatment. They lived longer. So that's a big, big part of what I do with people. So whatever your symptoms are, and so this is where it becomes very personal. What are the issues affecting you? How is your body affected? What does your mind need to concentrate on to reverse? So hypnotherapy, I know a lot of people are afraid of hypnosis. There's all kinds of other things why it's okay, even if you're Christian, that hypnosis is safe. It's not, you're in full control, you're fully aware, but you're deeply relaxed. There is nothing you can be commanded to do without your consent. You are conscious, you are aware, you're just in such a deep, relaxed state that you can communicate with your subconscious mind about whatever issue you want to resolve. It's a safe, healing place. And when we discover some of the root causes or some of the emotional negative emotions that are affecting you, we can let that go. We can have it stop sabotaging your life. Mindset is another tool that I use often with people who have chronic illness. It's giving you an awareness of what are your emotional patterns? What are your thinking patterns? What is it you want from life? What is it you want to change in your life? And then creating a personal recording to hardwire it in a way. As I mentioned, if there's a belief, I'm not worthy, I don't matter, and that's what you think every day, then that neural pattern, that pathway becomes very strong. So to change that to being, I am worthy, I am amazing, I matter, then it has to be strengthened, it has to be reinforced, and eventually. And that's why the recordings need to be listened to for at least 21 days. I usually tell people 28 days for a physical issue. And that way the negative pathway will be pruned off, will disappear. And there can be ways that memories from your past, even if you're not consciously remembering them, can affect you today. Like the public speaking being, who would remember being laughed at when they're in grade 1 or grade 2? And yet subconscious mind thinks, oh, you can't speak in front of people, they'll laugh. And that can hold a person back. So energy release, I've been certified in this modality, subconscious release technique. I find it to be a great complement for the hypnotherapy work that I've learned. It's more focused on thought patterns. Hypnotherapy often works more on emotional patterns. What I find is that the energy release is fantastic for really recent things that have happened. And by energy release, emotional release, then you can be calm. And if you can be calm when things happen, then you can react more logically, and you don't get agitated, you don't get upset, you don't go through a lot of angst, a lot of upset. And so it's a very valuable tool to add on. Okay, so for stroke recovery, I recommend you do 3 packages of 6 weeks each, and I'll describe what would be part of each. So I do have some recordings that are available so you can listen to my voice. Make sure you can resonate with my voice, because you'll be listening to me every night, every day for a long time, and it's part of this moving towards wellness. So for the first 6 weeks, I would do 2 hypnotherapy sessions, and that's mostly based on the Marissa Peer method of Rapid Transformational Therapy. And it's a protocol that combines well-known techniques and tools like cognitive behavioral therapy, CBT, like neurolinguistic programming, NLP, this visualization. And so I do one for the emotional release. What kind of grief, what kind of negative emotions, what's holding your immune system back from healing? And then the personal visualization, which again depends. And if you have many issues, like you have your shoulders, you have your arm, you have your hips, you have your leg, we can do all of that in one visualization. But your mind might select one aspect, and that might not be the aspect that is most important to you right now. So if the movement of your hand is the most important, then we'd concentrate on the hand and the arm in this first week. And then maybe in the next session, work on expanding it to the leg and the feet and the walking. So it depends on where you are at in your recovery. And so for some people, I'll do the emotional release first and then make a recording that's based on what comes up in your session. So in the hypnotherapy, you're asking questions and your subconscious mind is giving you answers, and the answers are generally in the form of memories. So we look at these memories, look at what's connecting it to today, and let it go. And the visualization, of course, is, what are the physical issues that affect you? How can we change it? So you would listen to it for like the 2 or 3 weeks, and then for some people, I'll have them keep listening to it. So now you've got 2, so you listen to one at night when you go to sleep, and you listen to one in the daytime. And then I'll mix in these SRT sessions and then coaching sessions. I'm a former librarian. I'll give people lots and lots of resources that can assist them if you are ready to listen to various videos, if you want to read books. I've got lots of information to help you if you're interested. Okay, then after that first 6 weeks, then starts over again. but it's like layers of an onion. So I do a full session on what's called mindset, looking at your thought patterns, your emotional patterns, your looping thoughts, what you want in your life, and making the recording so that you're reinforcing to your subconscious mind, to your mind, this is what I want to happen in my life. This is how I want my body to function. And the update of the visualization, as I mentioned, if we work on hands at the beginning, you might want to work as you get more response to your hands, as you respond more to the physiotherapy or the chiropractor, you may then want to expand it to do more with your legs or your mobility or your communication or your speech, whatever really needs to respond for you. And then more SRT and more coaching. So we talk basically every week. You have the recordings that you'll listen to. You'll listen to my voice every night and possibly every morning. So it's effective, it works, but it's not something that you just come and listen and then go away and don't do anything. You are an active part in your recovery. And I encourage you how to incorporate that into your life. So package 3, again, it depends, how much, how affected you've been by the stroke. Not everybody needs this third set of 6 weeks, but if you do, then again, it's like taking off the layers of the onion, going deeper. What else is affecting you? What else has happened in your life? What else do you need to release? What else needs to change for visualization? What else do you want to happen in your life? So that's sort of a summary of how hypnotherapy can help in general, what kinds of tools I use in various sessions, meetings with conversations with people. So my background is I have an honors degree in biological science. I sort of generalized, but in 4th year, I did human genetics. I was working towards the idea of becoming a genetic counselor. I then went to, I got my Master of Library in Information Science. I've had a career as a research librarian at an agriculture medical institution. I worked with clients, including molecular biologists, microbiologists, veterinarians, people in various aspects of food health, people in the One Health, which is the idea of the overlap of human health and animal health. I trained as a doula in 2013 when my granddaughter was born. I was with my daughter at the birth of both of my grandchildren, and I attended 8 other childbirths of women I was working with at the time. In 2018, I trained with Marissa Peer. I went to the United Kingdom. I took this Rapid Transformational Therapy course, and I was they have a program of therapy called FAST, Find a Specialist Therapist. All the therapists who work in this program are moderated, are vetted. Everything I did had to be recorded and reported and evaluated. And so I was a specialist for physical issues, chronic pain. I worked with cancer. I worked with stroke victims, stroke recovery, and it was an amazing experience. I've recently trained with hypno-oncology, working as a specialty for cancer and hypnosis. That's not really relevant enough to people with strokes, but I did learn some tools and techniques in this course that will be very helpful in helping people. I've studied with Eva Clark, who's a hypnotherapy specialist with multiple sclerosis. I'm not certified, but again, I've learned tools from her that are very useful for helping people. I've been certified at level 3 by Coral Grant for the SRT, the emotional energy clearing, and I'm partway through working towards certification as a SRT coach. And like I said, I'm a librarian. I'll give you as much to read or to watch as you can deal with. Not everybody wants to do this, what they call homework. Other people, they want to know more. So if you are interested in knowing about medical aspects of this kind of research, PubMed is the database created by the US National Library of Medicine. There's over 1,000 peer-reviewed studies on hypnosis or hypnotherapy and stroke or brain injury. I highly recommend people read autobiographies of people who have had a stroke and recovered. What did they do to recover? How did they, look for something optimistic, look for something that you can follow. And her TED Talk is interesting, is fascinating. She was a brain scientist, and she describes how she got into studying neuroanatomy, neurology, because of her brother being schizophrenic. And then when she had a stroke, she was observing the stroke from the inside, not just from the outside. So she's got some fascinating insights in her TED Talk. If you're interested in actually seeing training on stroke recovery, Angie was cell command therapy, which is a specialized tool within the Rapid Transformational Therapy protocol. And she had cerebral palsy. She had birth damage, just like my son. And there's a video on YouTube of a class situation from a number of years ago. And it's the only training session by Marissa Peer in the public domain. So that's available to watch. And otherwise, I'm thrilled when I can help someone who's got physical pain, when I can help them to alleviate pain, to alleviate whatever their medical problems are, their physical issues. I'm always astounded when the emotional connection can make a difference in their pain. And there's even fun things. I've helped friends who want to play better golf. And it's just, I know nothing about golf, so I just tell them they tell me what they want to do to have a better golf game, and I just record it back to them. And it's fun. So I love the work I do. I'm very passionate about helping people. And if you want to know more, please contact me. And thank you very much for your attention. And